If you like this video, please subscribe to the YouTube channel and press on bell icon for notification. Thank you. In today's video, we are going to be discussing about types of swallowing. So before that, let's take a look on infantile gum pads. As you can see in the figure, that infantile gum pads have got gap between them anteriorly and they contact posteriorly. So when an infant swallows, the seal has to be maintained between these gum pads. As a result, tongue has to come anteriorly and it has to create a suction not only anteriorly but laterally as well between these gum pads. And an infant is able to swallow finally with the help of contraction of facial muscles after the suction is created by the tongue. This infantile swallowing usually disappears by the first year, and suckling reflex also disappears at the same time. The infantile swallowing is seen only prior to the eruption of buccal teeth in primary dentition. Now let's discuss retained infantile swallowing. Retained infantile swallowing is when the infantile swallowing continues beyond the age of infant. In retained infantile swallowing, the tongue thrusts violently in between the teeth. That means that the tongue thrust does not stop prior to eruption of the buccal teeth, and still the tongue is trying to create a seal between the gum pad anteriorly as well as laterally. As a result of this violent tongue thrusting between the teeth in front and laterally on both sides, there is instability of occlusion. And mind you that retained infantile swallowing has got the poorest prognosis. Simple tongue thrust swallow. Simple tongue thrust swallow can be seen in all the places wherever you will find anterior open bite. This anterior open bite can even be due to habit. As a result, you can see this simple tongue thrust swallow in case of digit sucking or thumb sucking. What happens due to this anterior open bite? The seal is lost in the anterior region of the mouth. So the arches are in contact posteriorly, but the contact between the teeth and the seal is lost anteriorly. As a result, the lips and the mentalis muscle have to do extra effort to create the seal anteriorly whenever the patient tries to swallow. Hence, the contraction of lips and mentalis muscle is seen along with the mandibular elevators in simple tongue thrust swallow. Clearly, this is a case of anterior open bite with good occlusion of posterior teeth. After simple tongue thrust swallow, we have another type of tongue thrust associated with the tongue, that is complex tongue thrust swallow. What happens in complex tongue thrust swallows? The teeth have lost their contact even in the posterior. So there is no molar contact whenever the patient is swallowing. So in this complex tongue thrust swallow, not only the seal is lost anteriorly, but the seal is lost posteriorly as well. So the contraction of the facial muscles has to occur. to create the seal posteriorly, and there is absence of the contraction of mandibular elevator. Besides the contraction of facial muscles and absence of contraction of mandibular elevators, the anterior loss of tooth contact is same or shared condition in simple tongue thrust and complex tongue thrust. As a result, the contraction of lip and the mentalis muscle is present even in complex tongue thrust. In complex tongue thrust, there is open bite with poor intercuspation, and instability of occlusion is also present. But a noteworthy thing to note here is that complex tongue thrusting is not necessarily due to tongue. It can be due to other reasons as well, wherever there is condition of poor intercuspation and instability of occlusion. If you like this video, please subscribe to the YouTube channel and press on bell icon for notification. Thank you.